and then we'll go with the names that we don't see. So Dan, are you there?
I'm here for about 45 minutes, and then I'll come back on at about 2:15.
Okay, so would you like to introduce yourself?
Yeah, so Dan Ferguson with the Allied Health Center of Excellence, representing the community colleges.
Okay, so if you're not speaking, if you could mute yourself, that would be fabulous. So how about Jorge?
Good morning, everybody. Jorge Rivera with Molina Healthcare, representing the NCO sector.
Okay, Mark?
Sorry, good afternoon, Rhonda.
Oh, okay, Susan?
Susan Grindle's here.
Thank you. And there's somebody named caller number 2.
That's Susan.
Oh, that's Susan?
Okay, so the microphone spoke up.
Okay, thank you. Okay, so are there other people on the phone? Is that all on the phone? Then let's start with Les.
Sorry, who's Mark with?
Mark is Hope Source? Okay. All right. So Les, let's start with you.
I'm Les Stolniker. I'm from BSD 123, and I'm here to help kids initiative.
So if you speak up just a little bit so people on the phone can hear you.
The people on the phone hear me?
Try it one more time.
Hi, I'm Les Stolniker. I'm from BSD 123, and I'm here for education of kids.
I'm Ronnie Batchelor. I'm consumer representative, and I work with Lord's Mobile Outreach Team Troop Program.
I'm Ashley Fernandez. I'm just here as myself today. I just came to greet everyone today, and I'm no longer working for Greater Columbia, so I just wanted to make sure that I got to see everyone again one more time.
Great.
Wonderful speech.
Thanks for being here, Ashley.
Thank you.
I'm Wes Lucky with the Greater Columbia.
I'm Sandra Flores with the Yakima Valley Farm Workers Clinic representing FQHC.
Hi, Carol Moser, Greater Columbia ACH.
Ruben Peralta, Greater Columbia ACH.
Jen Shelton, ACH. Sierra Foster from Free Health. Jane, Senior Life Resources, representing philanthropy.
Brian, there's a seat over here at the table.
Where's the University, Brian? Sponsored by me. I don't buy. You can have the seat.
The finance speech.
Patrick Jones from Eastern Washington University.
Martha Lemon, Columbia County Public Health, Fairfield County Public Health Board Vice President.
Chelsea Eaton, Columbia County Public Health.
Sam Rideau, Greater Columbia.
Diane Haler, Greater Columbia.
Martin Sanchez, Greater Columbia.
Becky Colon, Greater Columbia.
Brian Gibbons, Street of Sunset Hospital.
Eric Nilsson, I represent public service, or what is it?
Public safety.
Public safety. something I do in that area, and with the Kennewick Fire Department.
Rhonda Hoff, Yakima Neighborhood Health Services, representing the housing sector, and board chair of GCACH.
Dina Otis, the Lord's Counseling Center, and I represent behavioral health.
And Madeline Carlson with People for People, representing transportation. Julie Peterson with Kittitas Valley Healthcare, and I represent hospitals.
Chelsea Chapman, Greater Columbia ACH.
Victoria Ryan with Ideal Option. Lauren Noble, Greater Columbia ACH. This is Rachel Guest with Greater Columbia ACH. Tanya Cruz, the Accommodation.
Joel Chavez, CHPW.
Okay, and it looks like we've had somebody else join on the phone. So if you haven't introduced yourself on the phone, would you like to do that now? Okay, so we'll take that. All right, well, so the first thing on the agenda, as always, is our attestation of the conflict of interest and self-dealing transactions. So if the board members would take a look at both of those paragraphs, and then from that, take a look at the agenda, and if you see any items that you believe may be a conflict, either mention it now or we get to that agenda item. So if not, then we have one item on the consent calendar, which are the minutes.
Madam President,
Yeah.
small presentation.
Okay, would you like to do that
Yeah.
first? Okay. So first, we're going to, Carol is going to make a small presentation.
With appreciation that Ashley is here today. And Ashley was my very first employee for Greater Columbia ACH. Been through a lot together. Standard of taking amazing minutes. She really covered a lot of detail in those minutes that have set the stage for our foundation and kind of helped me through a lot of tough times. And she was also very, very gracious and always would put thank you to all of our sponsors and on all of our minutes. And so Ashley, we just wanted to thank you from the bottom of our hearts for being an important part of the growth of this community and this organization. So thank you so much.
But say them loud so people on the phone can hear you.
Okay, well, it has been a real honor to know each and every one of you in this room. And on the phone. Thank you. So thank you very much. I've been through this organization right after my first daughter was born, and having my second child, and many of you saw me through all of that. I really appreciate it. It's been kind of enormous growth. It's been an honor to work with Carol. And I feel so grateful that through many times I go and spread the word about Greater Columbia and about the lovely people who work here. And, awesome. Thank you.
Ashley. Great. Okay, well, thank you.
Thank you.
I'm glad that you're here today and we can celebrate with you.
Thank you so much. Yeah.
Okay, so the consent calendar has the September minutes for the board meeting. Hopefully you've all had a chance, or most of you have had a chance to look through very complete minutes, which Chelsea is carrying on the tradition of keeping. Standard. So I would entertain a motion from anyone to approve the minutes.
So moved.
Second.
So approve, or motion by Brian and second by Eric, the public safety guy. Is there any discussion?
Just one question.
Yes.
It has me at the same phone, and I was actually present. I have it updated here on the printed one. It was
Okay.
but thank you. Thank you.
Any other discussion? All in favor?
Aye.
Opposed? That was an aye. That was an aye, right, Dan?
That's correct.
Sorry, I'll slow down next time. Any abstentions? Okay, minutes are approved. Thank you very much. So, Carol, reports and updates.
The standard report, we'll go through the trackers first, and then we'll circle back to some of the written materials in the GCACH report. So it's cohort 1 and cohort 2 trackers, Jenna.
So this is cohort 1. So this one. Right on.
This is the chat.
So this is. Nice. So this is the tracker for cohort 1, which is mainly the primary care hospitals and some behavioral health organizations that we're working with. The third quarter just ended, what's the 17th, 2 days ago. The 15th was the due date for the workbooks, the reporting workbooks through the portal. So now so the 15th was the deadline for the workbook. Everybody got them turned in. There were some glitches with the portal that some organizations had problems with. We were able to work them out. So everybody's good in that sense. So you'll see under the 3 dates that the organizations have turned in their workbooks. And currently we're on quarter 4. So in January, you guys will see that will complete their first full year of going through practice transformation. And they have done, amazing work in each organization and on every site that we're working with. That is just great to see, how they developed from the starting point, quarter 1, to the many great things that they have done for their patients, to this work that we're doing.
So the next tracker is the Cohort 2 tracker, which are former DHO and organizations that just reintegrated. And so they are in quarter 1, so you'll only see one is going across this tracker. We kind of have like a running joke that it's good to go second because they get like all of our lessons learned and knowledge. And so we had a few organizations actually turn theirs in early, which was great. We had some glitches, and I'm smiling at Dana. They learned about the save button. But we worked it out this quarter, and so they survived quarter 1 and got all that baseline reporting done. And so now we're going to be focusing on tracking and measurement for those organizations and how to progress forward. So it's a really, really good time working with all organizations.
So I'm going to talk about the opioid resource network tracker. So we actually have the GCACH, Valley Healthcare, and Whitman is the police service counseling, and Hilton, Columbia, and Garfield is Blue Mountain, Montana, and Tri-State, and all those were completed now. All the contracts are signed. They were just paid for the first of their enrollment and the contract being signed. Benton, Franklin, Walla Walla is our exemplar clinic, exemplar ORN. They are amazing. They had 62 inductions this month, which brings them a total of 68 inductions total. And they're doing phenomenal. So we will pay them for their second quarter, their second deliverable here at the next pay period. And then the other ORNs, they're not going to have their next due date isn't until January. So we're going to have a lessons learned meeting with Benton, Franklin, Walla, with the other new ORNs so that they can kind of let them know how they got started, what the things that they did to get referrals and the kind of people they want to have in their network. So we're going to have that on the 22nd. So we're excited about that.
Okay, my turn. The lane tracker. We kind of configured this to make it easier to read and also not have very bright colors like in blind view. So we're currently on the quarter 3, and today we took care of 2 deliverables with the lane participation, the lead presentation and presenting. And we have a couple others there. This quarter ends, like I mentioned before, our quarters here, for this purposes, don't fall like the regular quarters we know from January through March and so on and so forth. The last quarter ends January 31st of 2020. And the next category is the community health fund. Everything there has been completed for a while. This is This is the work that LINS did in finding the priorities in the social determinants of health. The next one is the third-party administrator milestones. Right now, the only one that's still in progress is for the Ben Franklin Community Health Alliance. However, Three Rivers Community Foundation, they have pretty much decided on who they're going to grant funds to. They just haven't notified any of them yet, so we're not ready to divulge those names just yet. But we can consider this completed. The sponsorship and the LIN training funds, we're still at only Benton Franklin Community Health Alliance region and the Blue Mountain region are the only areas that have taken advantage of the sponsorship fund. No one has taken advantage yet of the LIN training funds, although Kirk Williamson is going on, well, okay to call, okay to say, I forget the name.
Oh, yeah.
I forget, it's a youth suicide program that you mentioned. So he's going to go to a conference in regards to that. So he's probably going to be the first one to take advantage of the LIN training fund. So encourage your regions, your partners, and your networks to take advantage of those two funds. We still have plenty of money. Hurry up before Take takes it from me. Went over to me asking me.
I just stole a bunch of money from Wes too, so it's not like I'm picking on you.
Not alone, Ruben, let me tell you.
And for those of you that were able to attend the Leadership Council meeting this morning, it was great hearing from all the LIN leaders about what they're doing, the progress that they're making. It really is a great example of how you can create collective impact across 9 counties. And I think when we first started this, we weren't exactly sure how it would work, but it just seems to be working beautifully. Some LINs there's a lot of commonality, as Patrick pointed out this morning, in people addressing behavioral health. The transportation is more concentrated in the rural areas that everybody's doing amazing things. I think it seems to be a great success. So we'll move to the Greater Columbia ACH report. The first article is just a little bit about the learning symposium, excuse me, that we attended last week. Rhonda Huff was there along with all of the Greater Columbia ACH staff. Again, this is one of the deliverables that the Healthcare Authority has to provide to CMS. It's part of the special terms and conditions that they host these learning symposiums with all of the ACHs. At this particular learning symposium, Greater Columbia got to participate in a breakout session called Advancing Statewide Use of the Collective Platform. So with Collective Medical there as kind of the organizer and the owner of this software, we got to talk about provider stories and using Collective Medical tools. We got to share a little bit about why it's so important to Greater Columbia, given our high rates of avoidable emergency department utilization, and how we are trying to connect our providers to the Collective Ambulatory platform. And then we just recently learned that AmeriGroup has agreed to sponsor Kennewick EMS on the Collective Medical platform, so we're really thankful to AmeriGroup for doing that.
I have one. So I think we talked about this a little bit last month about the financial portal where the district money is held. Okay. That we're going to start earning interest on the money that's in our district account. So the still Trump Accounting Consulting Group, which is PCG, is still working on getting this information to all the ACHs a little bit easier, which would be through their dashboard on their website. But for right now, they're just sending all of us an email with a spreadsheet every month with the interest that's been earned. So this report was written for the August interest, and then I just today received the September. So we're actually at $44,000. At our finance, budget and funds folks meeting this month, we talked to them about the interest in that
because our charge is the district money. And so we told them that we were going to be working with the finance committee to figure out a plan moving forward for the policy for all of the interest, not just in the district, but also with our design as well, because we have quite a bit of money. You'll see when we go through the of interest that we've been earning in that account too. So we're working on that. We actually have a meeting scheduled in November that Brian is graciously hosting for us with the finance committee, so we can meet in person instead of over the phone to make that connection and write the policy and figure out what we're going to do.
I do now. That's why I have Angela.
Yes.
She knew.
Yes,
I'm sure she knew.
She does know. Yeah.
I mean, I know.
I wanted an article in the report, and I'll just do that while I have the mic, is about our move. So this Monday this week was our first official day in our brand new offices. We're working on getting unpacked and getting settled in and enjoying all of the resources that are around us. Carol walked across the street and had lunch at Costco. I texted Dad. She was so excited about that. So we're all enjoying having a lot of resources around us and being in a more area where we're a little more recognized. We've had people stop by the office, which has just been bizarre, you know. A couple of times Chelsea's come back and said, hey, somebody's here to see you.
Is there a doorbell?
No.
You don't need one anymore? You can actually get in?
It's been a big change for all of us, and I think everybody's happy. Rachel's working on designing our lobby area and our space so that it looks professional and clean and nice. She's very talented at that. So anyways, I think it's good. I don't have unless you have any
Open house?
Oh, sure. Open house is, the date's actually on here, the 25th, October 25th. It's Friday from 3 to 5. And we'll have tomorrow. We'll have refreshments and we'll just all be there to greet you, show you around, and let you know all transformation. Whatever you want to know, we'll be open. It's nice to see all of you.
So my article, this is kind of spotlighting quality of health. I went and visited them. I try to go at least once a month and visit them in person, all the way out in Clarkson. Since they're really far, I still try to keep that connection with them. So they have really came a long ways since we started. They transitioned. They were part of the IMC transition, so we helped them with that. They came in through the in the first cohort for practice transformation, not knowing really how what they were getting themselves into pretty much. And working with them over the past 9 months. They have a primary doctor in their office, they have an AD, they have medical assistants. They're opening a new location, which in this location, they're really thinking about whole person care. They're integrating dental. They're going to have a dental chair in their office. Their doctor's going to be there. They're gonna have they're trying to hire a PA as well, in addition to the MAs and their medical provider that they have. They're looking into bringing telehealth, telepsych into their practice as well, just because they have such high volume of patients that will help with that, create more access. I mean, their policies, they actually wrote policies around milestones and timelines, how often they're going to be looking into their patients, are they assigned to providers. They're also they wrote policies around their risk stratification for all of their patients and for high-risk patients that, come out from the risk stratification that they have to do through the workflow, through the milestones, which is, I mean, it's awesome just seeing how much they have came, from where we started and where they're going with all this work that they're doing. So good job.
Our next highlight is Providence St. Mary Medical Center, and we highlight them a lot because they're doing a lot of really good work in Wallowa. So they've implemented transitional care management. They have a hospital, a clinic, with a family practice, and an urgent care practice transformation. And so they've done transitional care management, which is TCM, the abbreviation, and they've been able to see lower 30-day hospital readmission rates. They've had way more patients complete TCM, if you see in that column. It went from 44 to 832, which is a big jump. And they've also been able to get reimbursement for that since they've been billing, and they've added a little over $150,000 to their bottom line. So that's pretty good.
I'm just trying to make sure it's, you. I had to get up and get water.
Evelyn, we're hoping you'll share a little bit about your story, your transportation story.
So for people, we've had a partnership actually with Confluence Health that helps to bring individuals in for cancer treatment from Grant County into actually the Wenatchee area for that. And it's been a very successful model, and part of that is that the individuals that are riding the bus, they're all faced with that, heartbreaking news that they have cancer. And so they really end up forming kind of a peer support system on that journey that they have, and some of those friendships have continued for actually years after their treatment and successful survival. So this is one of the programs that we have, and we just started October 1st with transportation from Ocello into the Tri-Cities, bringing individuals in for medical appointments as the primary reason. So we're seeing great success. It's a newly started service, and we hope to be able to see it continue.
And is this part of your Medicaid broker contract? So how do you?
So so it has been a great partnership in that Confluence Health is paying about a third of the cost. GCACH Transit, up until a year ago, they were able to support it with about a third of the cost. And then we received Washington State Department of Transportation funding that helps to support it. The new route that's coming in from Ocello, that is being funded a small part by Area Agency on Aging, AACCW, out of Wenatchee, and providing service in that area. And then the rest of it, the majority of it, is coming from Washington State Department of Transportation.
Great.
Yeah, so we're excited to be able to see that one grow and expand as well.
Great.
In the report is the Morning Collaborative. We have Cradle coming in November 5th, and so we have 90 people registered. So 90? Yes, we do. And then the November 15th one is they're going to be talking about presentation of residents and clinical workers in the clinical and community. And that one is going to be, Sam's going to be leading that one. On December 11th, we're going to be having Adam Falcone come. He's going to talk about negotiating contracts. And then the next two are about crisis. And so the crisis providers in our region are going to present. So on best practices and hospital at work, how crisis works. So we're still in the process of planning the rest of the year out for next year. Ruben has the last.
Where are you going to do the Ken Crable training with 90 people? This will
We're
hold.
going to open up this whole facility, both these rooms here,
Uh-huh.
and then so we're going to be doing it here.
Okay.
We did check with the fire code about how many people were
I know someone.
There you go, Eric. That's what the question is.
Mention, I don't care about that.
Greatest fear has. How do we get him on this?
Fire.
Okay, my turn, huh? Okay, we go again. What about the sponsorship fund? So I hope everybody gets the hint. Okay? There's money available. So this is an example. Dr. Justin Coffey's visit to Whitman College. This is an example of the great use for these funds. Dr. Coffey, he's an expert in suicide prevention. He shared that a lot of his experience in accomplishing zero suicide in his area where he lives for an amount of time. And we contributed $4,000 to dedicate it specifically to his expenses with his trip and his fee. So that really helped, and it was an amazing event, wasn't it, Jenna? Jenna and I were there. And so some of the highlights that Jenna shared with us, because I had to be early, the best prevention is the people connections with people, that kind of stuff. That what he says that is the best way to prevent things. And the highlight is, where is it? Connections. The majority of suicides, happen with the last sentence in the middle paragraph. The majority of suicides happen with people that do not engage in the healthcare system. So if we target people engaged in the health system, we are targeting the minority. So that's a very powerful statement right there. So here's a perfect example of what the sponsorship money can do. And there were senior leaders there, leaders in the medical field, just a wide variety. There were students there, medical students, Whitman students, and high school students as well. So it was a great event.
Thank you.
Any questions or comments about anything from the staff report? Okay. Okay, so I think we're ready for the financials. Becky and Brian?
Good. So, very quickly, I'll turn this over to Dr. Bruce to walk us through it a little bit. So again, we have our finance committee meeting earlier in the month. So we had the finance committee meeting earlier in the month. We talked about a number of things. Not the least was we've had a audit results, which are good. I think it generated a couple of questions to a follow-up meeting. Resident expert on that. So smart questions, the regular questions, right? But I think as usual, we went through the statements of activity. Everything was completely appropriate. There was a little bit of a bump in the expenses associated with the relocation to the new office. We spent a lot of time on that. I think that we are fine with all of that adjustment, and that we wanted to bring that forward to the board so y'all can see where those adjustments were made and where and maybe offline a little bit. So I think it has to do with just growth and development. Probably the first time trying these things, but again, the finance committee went through all of that, so we're all comfortable with it. I'll let bring all of that stuff forward with an updated SBAR and whatnot for the full transfer. Guys know. With that, I think we'll let Becky, if you'll speak to the monthly stuff, and we maybe can talk about the other stuff we've had. Thanks.
Thank you, Brian. And I totally echo that. Julie has been a really great addition to the finance committee. She always asks good questions, and some of those questions this month led to us having a offline kind of meeting with Moss Adams, with Julie and Brian and Rhonda were on the phone for, and Julie was able to ask some really good questions that brought up a lot more questions, and we're going to have another meeting with Moss to kind of clear up more of that and to so a lot of what was on the audit, they tried to make our audit this year match what the other ACHs were doing. So all of the CFOs for all the ACHs get together monthly and talk about our financials, and GCACH has taken a different approach to reporting our financials than the other ACHs, and our audit team this year, who was different from last year, decided, had some meetings with some of the other ACH audit teams, and they decided to bring our financials in more of alignment with the other ACHs. So that's where all of the questions were coming, most of the questions were coming from Julie and the other members of the committee and myself and Carol, we're just trying to all understand their thinking, because our thinking on them is different. But the bottom line was we all decided that we didn't want to be different in this instance. Not that it's not a huge difference, it certainly is, but for the financials and for the ACs, we decided that it would be best. So we have the audit, it's in draft form, and once we get everything all cleared up, we'll bring it to the board.
So is that alignment around the moving cash to accrual, or is it something else? Yeah, it was mostly that, cash to accrual and
deferred revenue. The
and
deferred revenues is really the big thing. The cash to accrual was, I think, again, when we brought Julie on, that was, and Brian, it was something that kind of we all started talking about, and then the other ACHs, and when all the audits happened this year. I mean, really, this was everybody's first year of operating, and so things just changed and things shifted, and so. But the deferred revenue is definitely one. And also, in 2017, we didn't report the district money on our financial report, and we hadn't been reporting it to the board even until recently. We mostly just talked about the design funds and operation funds. So putting the district money on our financials, and then we also put our IGT funds on our financials, which one of the things that I really disagree with, and I think you did as well. So those were I think the two really big things that were changed this year from last year. But when they laid out the report, they have the 2017, and they also have the 2018. Ronnie?
Yeah, so I'm hearing you, I'm understanding what the differences are. But my question is more so, why can't we be different? And if it's working well for us and it's working well for the state, I don't like to follow the leader thing. I think that when you're blazing a trail, which we've been doing on this board, and that your organization itself has been blazing that trail, and we've been doing a pretty damn good job of it.
I agree with you. I totally agree with you, Ronnie. And I'm not following. So I agree with you. As far as the financials are concerned, and I know Julie, you want to speak to it a little bit better than I can. Being an outlier when there's 9 of us that are receiving our funds from the same place, and one of us is reporting it differently, kind of throws a red flag. And so that was the reason that we decided to come in.
Yeah, so I always lead with the disclaimer that I'm a recovering CFO, so I love this stuff. Somebody will have to take my microphone. But this is very complex accounting, and I think I understand what you're saying, but at the heart of this is what is called revenue recognition. And we get a big check through the door, and we have been recognizing that as revenue. And in fact, we haven't earned it yet. So you earn it actually through the agencies achieving the deliverables that are out there. So we've had these big boluses of income, which in fact, we should have run more smoothly through the income statement as it was paid out, and the agencies actually earned it. So but they present themselves in very different ways. So that's how the design funds ended up at the end of the year with about $5.4 million in the bank, but not earned through operations. It gets very complicated because we essentially have a fiduciary holding $25 million that we're just sort of the reporting agency on. So there's a lot going on. So kudos to you guys for keeping it straight on a monthly basis. But yeah, I think spending the time with Moss Adams was important because we're making a whole shift, not just in 2018, but that means a restatement of everything that we've seen in 2019. It's brand new principles now. So there's some heavy lifting to go on, and I think it's worth spending some more time with the auditors so we understand exactly what's going on. But this is a complicated way to earn a living with the different ways this income comes in.
So in that, is it more simplified or is it more time consuming and taxing?
It's more taxing, more time consuming, and accurate. It really is. It is, and it's in keeping with accounting principles. When it's one thing as we were ramping up, but there's millions of dollars on the statements now. So
I appreciate you.
I'll stop now before I get
That helps. Good. I still go for all.
I do too, Ronnie, but I also think the biggest thing that Becky said was that it's always a red flag, and I'd like to see the leaders without having the hurdle of a red flag in our way.
Exactly.
That will eliminate this, and we can still blaze our trails. And
I agree.
We are leaders in different ways. With the financials, we need to kind of see it.
And I see why, and Julie, I appreciate
you bet.
you putting yourself forward.
So on the financials, do they come with a recommendation, Brian?
Yeah, yes. So we'll go ahead and recommend, the Finance Committee would make recommendations to the board to accept the monthly financial package. I'd look for a motion on that.
Okay. So I just made the motion.
I just made the motion.
Okay.
So you need a second.
Is there a second?
I second.
Okay. Take your pick. You had joint seconds from Ronnie and Sandra. Is there any further discussion on the financials? If not, all in favor?
Aye.
Is anyone opposed? Okay. Any abstentions? Then the financials are approved. Thank you very much.
So did we want to speak to, did you want to speak at all, Becky? I guess I'm telling you to speak about about the SBAR for the moving expenses we can watch it.
Yeah, so as far as this packet, you guys have seen this. The only thing that is new is there is a spreadsheet. We can put it a little bit. There's a spreadsheet that has most of our actual moving costs. And this is been updated since the Finance Committee meeting also. So under the moving costs, you go down just a little bit. So you can see that the first column says board approved, which was the option one, if you remember, was to buy new furniture instead of moving their furniture. And so all of the what was approved at the board meeting. And then the actuals column is the actuals is showing you what we've actually paid to date. And so the IT got updated. I'm just giving you the updated version. I apologize. So the actual for the IT went up to 6,155. We did that yesterday, and anyway, you can see that our the biggest change in the actual our furniture expense, the buffer. And some of that was we had some last minute design changes with some of our staff cubicles, and we had some charges in the estimate, like we didn't know that we were to when a couple of things. So it went up pretty significantly. And then our IT and same thing. We our IT person walked through the all of our computers and stuff, and also to get the new office set up. Obviously, it also is estimated to include tax, so this is the extra cable things that he started doing. That's awesome. We're in the original SR, we talked to you guys about that we were going to try to sell back our old furniture that's at CAC to buy. And so they were giving us a discount, a credit on our furniture. And what actually happened is Carol spoke with the director, Judith, at CAC, and she worked out a deal with her to have CAC purchase the furniture from us. So we left it all there for CAC to use. And we had still had, if you remember, we still had a lease to pay out, and so we kind of exchanged the lease for furniture. So it's a nice deal for CAC. They have some nice furniture now. And Dallas didn't have to move it, so that's fine. So that worked out. And then the other thing that we still are working on is our fiber contract that we had at CAC with CenturyLink. I think I told you guys before. I would never recommend it to anybody. So we did get a verification that they stopped our contract, but I can't get a hold of anybody to try and get them to give us some money back because of the way that we've been treated. Working on that. I promise. So, and then we had one other, we did a tenant improvement on that was kind of a weird space. It was just a big open to a we had a contractor come in and frame it up and put a door on there for our new marketing manager so she could have an office because we were one short. So that was an extra expense too that we didn't report to the board.
So at the end of the day, thank you, Becky. This is, we went through this in pretty great detail. It became apparent that we're going to be able to budget on this stuff. So I don't want anybody to think that the staff did not discuss. They gave me a call and said, we're going to be upside down, and what do we do? I said, you know what, I think they might have called you. And I said, well, let's just all sit down and talk through it, figure out what it looks like. Manage the lessons learned, see where we can find opportunities to get some of this money back. We went through all this exercise. Ultimately, at the end of the day, these are good investments. It is completely appropriate. I know why this stuff happens the way it does. We've been here before. We all know why these things happen coming forward now. And so I am happy to recommend we accept this updated budget. That reservation. We've been through this. I think the staff did the right things. Leadership did the right things, reaching out to us. I'm greatly appreciative of the $10,000 recovery on the lease buyout. I think that's a huge deal. And I'm good with this. I think that not the best. So I go ahead and make that recommendation.
As in a motion?
I can make a motion. Second.
And second by Les. So is there any further discussion?
Good, thank you.
Okay, so we have a motion and a second, and I don't hear any further discussion. So all in favor?
Wait, this is what the motion was, right?
Yes.
No, right there.
Yeah.
Okay, I just want that, because that was what I seconded. One in the box.
Yeah.
Okay.
Okay, so all in favor?
Aye.
Is anyone opposed? Okay, lots of good details. Thank you both so much. Okay, so we're going to talk now about the RFP for the Community Resilience Campaign.
Yes, that would be me. Okay, so the first document there's going to be a couple. That one is the request for proposal we sent out last month to 10 media companies. And And it's pretty much asking for proposals to conduct the community resilience campaign pilot in Yakima. It specifies the goal to bring awareness on the neuroscience and the trauma-informed approach to the community. And it asks about what native platforms we're already thinking about. So unless you wanted to, I go to the whole RFP, but I think you would be more interested in. I see a lot of heads shaking out. Not after lunch. I can read it word by word. So let's go first. We received the proposals on the 7th of this month, and then we asked the communications committee to score them. We received, out of the 10 companies that we sent them to, 5 proposals. So the communications committee scored them, and on this sheet right here, on the table that you see there, we see the results of the scoring. And the 5 organizations that sent proposals, you can see them there on the left: PS Media, the Field Group, SPD, and G, and 40 Point. And you see the scores there on the far right. And so this leads me to the next document. It's a next bar where we're going to ask the board to authorize the next step we want to take. So right there on top is pretty much just summarizes what I just talked about. Under the background section, you can see the different, the 10 media, the names of the 10 media companies. 3. That's right. Okay. I was thinking of the fine. So I have a breakdown there by the names and the location of the media companies where they're. These are the 2% questions to proposal. And those 10, the 5 analysis, those 5 are the ones that submitted proposals. See again how they scored. So what we're asking is that what we want, the next step, what we want to do, we want to make some phone calls to the current and past clients to what kind of working relationship they had with media companies. We want to do that with the top 3 because we think that the proposal can tell us some things and very good things, but we can find very valuable information by following up with some references, with calling their past customers, and also we want to interview them, and we want to include GCACH staff, communications committee members, and invite some of the resilience task force members to be part of the interview panel to find out more about this top 3 candidates. So in the box. Anyone has any questions so far? I thought I'm going a little fast.
So this is for the pilot project, I understand, in Yakima. But would this same, if the pilot project is successful, does this same group reach out to within a certain field in Columbia and do anything there? Do we have connections there? Or would we have to, if this is successful, the idea is to go all 9 counties, right? Would there be presence, or do they have presence already in that area?
They grade everyone. If I'm not correctly, just about every one of these companies have done outside of the state. And that's a discussion we haven't had as a staff, whether we would use the same company. But that's a discussion we need to have, probably depending on the results of the pilot.
Ronnie?
Yeah, I have a question. So you're calling it a pilot. Does this mean that subsequently we're going to have new media stuff going out, so new clips coming out of that? Or are we just going to be doing this one project and that's it? So are you going to have episode 1, 2, 3 after the pilot? That's my question, because in media, pilot means the beginning of something, and you're breaking ground on something new, but it also means there's to follow. So are we going to be following that pilot with other?
New materials, new spots, that kind of stuff.
Right.
That, assuming that the pilot is successful and we want to continue it through the rest of the 9 counties, we're going to rely a lot on the media experts, on the market experts, onto whether we want to do spots or add some more on top of them. I don't think that's a decision that we should be making ourselves, because that's why we hire a media company. So that's I guess to be seen, to be decided.
So by having a pilot, this is a limited amount of money, a trial kind of thing. If it goes, the company that did the pilot seems pretty much lined up to jump in and take the whole contract, and that could be a significant amount of money.
Yes, and that's to be decided, later on.
But I mean, you're I guess you don't have to do it, but I guess, so this is kind of a trial period. We're gonna test you and see how our relationship works. If you don't like it, we'll go somewhere else.
Yeah.
Okay. Thank you.
Joe, utilize cost as one of your determining factors in these events?
Yes, and well, communication, so far the communications committee are the only ones who have scored this, and I'm very sure they looked at cost and where that money was going to. I know one that we're not going to continue, that one that we're not going to interview or call. They were using almost half of the money just on production costs. Very little on actual media placement.
Right.
So they're not getting, they're not moving to the next step.
Sure.
I know that there's a couple of people here that actually scored these RFPs, so if you guys want to speak up. One of the things, though, that I noticed when I was going through the RFPs is it was interesting to see some of the companies with different approaches. So on one hand, one of the companies is pretty much social media, Facebook, website. The other might be more outward facing. So I think one of the questions we need to ask ourselves of the community resilience campaign is this supposed to be an outwardly facing campaign to the community, or is this inwardly focused to individuals? And that having the opportunity to interview, I think, the media consultant will learn a lot. We'll understand, well, why did you think that billboards weren't effective, or why are you putting so much money in social media, or why are you focusing in TV? And each one of them came from a different perspective. Some did a lot of research around social determinants in your science, some did very little. And it was very obvious in the RFPs, but sometimes you don't get the full picture from a piece of paper. And I think it's really important for us to reach out and use this as an opportunity to learn from them why they made the approaches that they did. So I don't know, Rhonda, if you and Madeline want to talk about your...
I didn't actually get a chance to score the RFPs, unfortunately. But I do have a comment or suggestion, and I don't know if we're at motion time, but I don't know that I would want to limit the committee and group interviewing any of the media groups to just the top 3 scoring applicants in this round. As someone who's done interviews before, it's very easy to get someone in an interview process who looks great on paper and doesn't look so great in the interview process. And since there are so few, I would like to leave it open to being able to pull in one of these other ones to see if maybe they're better in person than on paper.
So you're suggesting that they get 3 that they think are well qualified instead of taking the top 3 scores?
I think that they could start with the top 3, but if it's within that top 3, none of them seem to. What if none of these turned out to be exactly what you thought?
Yeah.
I don't want them to have to delay it to come back and out when there's 2 other options. Why can't we then just move up straight on to those 2 other options? I don't want to have to create an administrative process.
Yeah.
Here, actually, I have this, so I don't need that, right?
Okay.
Oh. Okay. Sorry. Oh, geez. I'm sure it's worth it. I'm sure the comments are worth it. So I did score it. And I thought that there were some pretty stark differences. So I would be supportive of you starting with the top three, and then if you need to go beyond that, you could. A couple of things going to Carol's comments that struck me was at least one of them thought that Yakima County ended like in Toffenish. It's like what happened to Sunnyside and Grandview and going down. And I really appreciated your comments about some were much more focused on social media, and it's like, what about the rest of our Valley residents that don't really tune into social media? So I thought there were some pretty stark differences between among the and I liked your process about the interviews and involving more people in it. Did any of the staff score these?
No.
So these were just community members, because I was kind of curious on where you all would have ranked these.
So I did my own internal.
Yeah. So were they close? Did your top folks compare to the committee?
They were in different order.
Different order. That's what I meant. Okay. All right. Well, do you want to make any comments?
And I agree. I think having the top three candidates, and I really looked at their familiarity with the population that we're wanting to reach and how well they could speak to that, as well as their past experience. And that was what I saw really the stark differences.
Just a point of clarification, is the pilot for Yakima County or Yakima MSA?
The city of Yakima.
Oh, it was just the city?
Yes.
Then that makes it even more curious, because
Yep.
Thank you.
Ronnie has a comment. So, who was it that did the interview, and what was the criteria they interviewed under?
There hasn't been an interview yet.
yep. We reviewed the RFP. There haven't been interviews.
Yeah. So, what was the structure of the RFP? Is it?
First.
Okay. And did you guys have any kind of inkling to go to the local universities to find out if they could use their television and students that are doing that and learning? So that's always an option, a cheaper option. Just let me know. I don't know. I know that when I was in New York, Lehman College had a media course, and also a graduate program with radio and television and film. And the students there were very out-of-the-box thinking, forward-thinking. The instructor was very versed in television and film, as well as in social media at that time, and implementing a lot of those things in their production course. So that's a thought that, and then the questions would be, for me, whenever I was responding to something, a contract, and I was looking for a job, a lot of the questions came on what my previous has been done, and when it revolves around what kind of money and budget that I'm looking at, and all these other things, components that were involved. And if there was going to be an art director involved in that with the company that I was going to work with, and that would kind of move my dollar bills around how I would charge. So I don't know, but what all was involved in this. I'm going to read it, so I promise. I didn't read this before I came. I didn't have enough time.
I wanted to answer your question. The direct task force was to search for a one-stop shop for experienced ad agencies, media companies that can do radio, television, print, billboards, mailers, and I don't know if university students have that kind of reach that can potentially So that's what we were going for. However, I wouldn't discount the possibility that the media company that we hire, they're going to need different vendors. They don't do everything themselves. Their offices, so they're going to be reaching out to possibly Spanish-speaking translators, Spanish-speaking talent, print people. So they're going to be hiring other vendors to do some of the work. So I wouldn't discount the possibility of them reaching out to the universities, but that's really going to be up to them.
I appreciate that. I didn't get to read this. I was trying to catch up. I do apologize for maybe.
So what do you need from us? Do you need anything from us today, or was this mainly information?
We have a recommendation. We need the recommendation from us is that the board authorizes GCACH staff, the communications committee, and the members of the task force to select a media company to award a contract. 3 applicants, their reference checks, and interview. And we can probably add Sandra's suggestions that we cannot find a winner of the top 3 to then make it.
So a minimum of the top 3 will be interviewed.
Yes.
I would like to make a motion that's over advisement from this, and I would actually just like to take out the top 3 applicants. I think you guys can make this contract based on reference check, communication, interview performance, and how many of the 5 you guys want to interview. I think that's the lead for me, and I was.
Okay, so Chelsea, did you get that, or do you need her to restate the motion?
Up top.
Yeah.
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 Let's leave it up to us to decide how many.
Yeah, I think you guys have I think it's a little in the lead for these. You only get to choose from these 3. Okay. I think I appreciate the opportunity to provide the input, and I think, but I also, as mentioned, your all rankings weren't included in this, so I think if you wanted to include those in here, to select who those top 3 you are, or top 4, or however you get to the interview, I think I'm really going to trust your judgment.
So that's a motion from Sandra. Is there a second? Second from Eric. Is there any further discussion? Okay, if not, all in favor?
Aye.
Is anyone opposed? Any abstention? Motion carries. Okay, good discussion. We are on the revised workforce committee charter. Carol?
So, rewinding back to 2017 when we were in the throes of certification for Greater Columbia ACH, we had assistance from what they called the resource coordinators from the Healthcare Authority, specifically Mike Bonetta, who's from HSU, policy person to Governor Kitzhaber, and really one of his fortes is governance. And as we were forming our organizations and trying to figure out what kind of committees would serve this board of directors, we recognized that workforce, being part of Domain 1, needed to have a committee to address workforce needs. We were lucky that we had Dan Ferguson on board, who's a workforce expert, and Mike Bonetta encouraged us then to create charters for all of our committees. So it's kind of a confession, I didn't necessarily put pen to paper on all of these different charters. And I think when I look back, I think Mike Bonetta actually helped provide some of the language for the Workforce Committee charter. So as we have gotten more sophisticated as the Workforce Committee has come together, we've recognized that there were needed changes in the policy. The Board of Directors is our policy group, and so we had some suggested changes to the Workforce Committee charter. One of the things was the number of people on the committee, whether it was a committee in and of itself or a working group, whether or not there needed to be term limits. And so what we did was just basically clean up the committee charter to reflect those things that I just talked about. So I guess the first thing would be on the top of page 2 under composition, that the workforce committee will consist of between 10 and 20 members. and it's chaired by the Workforce Sector Board of Directors. That stayed, but that the second sentence is that the Workforce Committee is a work committee, and the members are invited from the Leadership Council, Board of Directors, and Workforce experts. So Patrick Jones, who was here earlier, is part of this committee. Aisha Schulig, who is our regional economist in the Tri-Cities, is part of the committee. We have other committee members from the school district, Houston School District. So there are a variety of members that don't attend necessarily our leadership council, but are workforce experts themselves that attend these committees. The composition remained the same in terms of a focus on educational institutions, workforce experts, community colleges, individuals with experience in workforce design, and then in that final paragraph, we had limited terms to 1 to 2 years, recognizing now that there's really no need to have term limits. We said that the members of the Workforce Committee would serve throughout the duration of the Medicaid transformation project. Under decision-making, we had a majority being 70, actually we had 75% of the members present would have to enact a formal recommendation. We changed that to a majority of the members that are physically or electronically present in order to make that decision, and that those recommendations then would go through the board for final approval. I see here under the amendment that we were actually supposed to go through the bylaws committee to make any changes to the charter, so we might want to change that since that seems a little clunky. But otherwise, the reporting requirements remain the same as. So we wanted to resubmit this, update the charter to better reflect what the committee is actually doing. Well, I know you're on the bylaws committee. You're on every committee.
For 2 more months.
They don't look so happy.
Okay, are there questions about the Workforce Committee Charter?
Madeline, did you have any comments or less? I know you guys have been involved in that. Any comments about the charter?
The original one seems a little ridiculous.
Oh, yeah.
It's 75%.
Right, we never make it.
Yeah.
I mean, you know, are we here to you know, what are we here to do? And since it's going to the board, you know, we make this recommendation to the board. The board has that broader way to help make sure we don't try to do something silly.
I agree. Okay. So is that a motion?
I thought she said we were supposed to go through the.
I think we just amended that.
Yeah, we have.
Okay.
Take out
Yeah.
So we have a motion, but from Les, to accept the Workforce Committee Charter with the amendment that it doesn't have to go through the Bylaws Committee first, right? Is there a second?
Madeline.
Second from Madeline. Is there any further discussion?
Rhonda, this is Jorge.
Yes, Jorge. Yes.
I do have a comment. I think the charter is good, and I personally like the way the responsibilities are laid out. But in our caucus on the MCO sector, we discussed a little about this, and we wanted to put forward that there's a lot going on in the state on workforce development, and everybody has their many task force. I personally think that the healthcare authority has not done the best possible job in leading the initiative one part of this. But that also creates the potential conflict of overlapping work or reinventing the wheel more than once. So we're hoping there could be some maybe addition to the responsibility to really focus. And Dan knows this because Dan is in 5 of those potentially 6 workforce teams, or maybe he's in 5 out of 4. Because it's everywhere. But we really need to make sure that this charter has a little more detail on how we are going to interact with the Healthier Washington initiative on workforce and how we prevent from overlapping efforts. So I'm hoping you consider that.
Okay. Dan, are you back on yet? Okay, he's not, but certainly we can make sure he gets this information.
I just know that when we work on the committee, we're we're looking at the recommendations from multiple other groups working on workforce and that's how we're that's how we're coming to conclusions. So it's not that we're doing it independently, but we're including those other, and I can't remember the names of them, but there's 2 or 3 other groups.
Les, when you say you're working with other groups, are they other local workforce agencies? Are they statewide, or are they related to Healthier Washington? Do you know?
3.
Yeah, go ahead.
Jorge, if you look at page 1 of the policy, the last bullet point and responsibilities says collaborating with other workforce agencies and ACH organizations as appropriate. That's intentionally vague to cover all of our bases because more into policy.
That's kind of the one we were having issue with, Sandra, because it is a little too vague. It's like, well, we'll do our best to work with everybody. I don't know if we can make it a little more explicit on the work on Healthier Washington to prevent overlaps.
Okay, well, we can ask that the committee consider that. We have a motion and a second, and the committee can take that for discussion purposes. Okay, are there other discussions, other ideas or comments? If not, then we're ready to vote. All in favor?
Aye.
Is anyone opposed? Is anyone abstaining? Okay, motion passes. Good work. How about the Lynn training policy?
Okay. Are you getting tired of me yet?
No.
Ruben, we can never get tired again.
Okay.
I don't know, maybe a little.
This is the last one, I promise.
I am.
Oh, not for me. I don't have, you scared me there for a moment. There's one I haven't reviewed yet, I'm not ready for it. Okay, so this is the Lynn training policy that we updated, and we're going to ask the board to approve the changes. So the one that looks pretty clean, does not have a draft stamp and a lot of yellow highlights, that's the original. That's the one that was approved back in February. And the one that has the draft stamp and a lot of yellow on it, this one shows the changes we want to make. I would like to, if you don't mind, only point out because the purpose of the changes, the main purpose is to make it less restrictive, okay? And there are some other changes that are more grammatical and added more definitions to some of the terms here. But if you don't mind, I would like to point out the areas that serve the purpose why we're making the changes, which is less restrictive. Are you okay with that? All right. So let's go ahead and get started. So on the purpose, we changed the wording there from Greater Columbia County Community seeks to encourage and support active local health improvement network participants, and we added and/or organizations because it was directed mostly to individuals before, and we want to encourage those organizations to work with their staffs to encourage them, or as an organization to apply for these funds. So that's one area that adds to make the policy less restrictive. And then if we skip to the second page, under ineligible trainings, there we removed some language that made it kind of restrictive. We removed, you look at the clean copy, the original copy, we removed the top two, request that benefit an individual, person, or family. And inevitably, it's going to benefit an individual attending the conference, okay? That, I don't know how that got there, but, you know, a lot this training policy was based a lot on the sponsorship policy, and that's language that kind of remained, and I myself didn't catch to remove it. And also the request intended towards a degree or certificate if there's a train out there that's going to serve the purposes of the LIN, of the region, it also helps the person professionally, well, so be it. Okay, so we remove that. Another, then we skip to page 1, 2, 3.
So we had a.
Oh, that's right, yes. We originally had allocated $5,000 for this LIN, and so we removed that because we understand that some LINs might be more active and also more populated. So we removed that depending, just some people do not ask or request money for this purpose. And other areas might request more, so we don't want to limit ourselves to just one region. Okay, so that's another area to make.
Do you want questions as you go along, or do you want to wait till the end?
Go ahead.
So this was my question when I was reviewing this was, do the requests come through the LIN, or do individuals or organizations apply directly to?
That's actually one of the changes. We are, the original policy that the individual would make the request, and they would have to go through the LIN, get LIN signature, and we are removing that. So now, Becky, director, that would make it less restrictive, and that's the. Okay, so back to the third page. On the timing, we had a month and a half advance notice, I believe, and we brought that down to 2 weeks. And under application process, we changed towards the bottom, just above the evaluation criteria, the last bullet point there, changed that language to the director of finance and contracts to be the person who approves the request. And the last changes is under evaluation criteria. We added number 4 and number 5. Special benefit, regional development, and GCACH just to create all the way across links. I'm not going to read the whole. These areas make it less restrictive. Any further questions?
So are the LINs okay with this with the proposed changes? Because what I'm hearing is that the LINs were able to have a set amount of funds, and now they're not going to have
They can have potentially more. We didn't want to limit anything to a certain amount because this can also potentially give a LIN. If other LINs don't use them. There's language here that but by the fourth quarter, it looks like a LIN is not going to use any money. We can.
But this also says that the LINs really don't have a say in how their funds are being used. Because if Joe Blow can apply to the ACH directly without the LINs having a chance to prioritize where the money is, then the LINs are really out of the loop.
That's a good point.
Well, what I remember about the reason we changed that was because it was written before and it really just said that the LINs was the only one to apply. And so we opened it up so that, actually, Rhonda, I think it was the discussion that we had with you. What came up was that, well, what if an agency comes to the LIN and says, hey, I have this training, I want to put this on, even though they're not a member of the LIN or the LIN, the LIN can say, yeah, great idea, application, and submit it to ACH.
And you know,
so that's what I remember that conversation was.
In the very first paragraph, we're encouraging active local health improvement network participants and organizations. So the LIN leaders need to know those people. You cannot have some random person somewhere apply for this money. So they need to be in some way individuals or organizations that are active with the local health improvement network.
So I would just say I don't remember that, Becky. I'm not saying it didn't happen. I'm just saying I don't remember it at the moment. But I asked the question when you sent me this a few weeks ago. I think that's what first drew the question in my head is just, do the LINs have, how would the LINs know? That was, I think, my question. How would a LIN know if somebody applied, if it's coming straight to you? And if there's any kind of, whether it's a cap on the amount or not, and we were in a position to prioritize whether we wanted to talk about, doing training around trauma-informed care or racial equity. And if a LIN had particular or passion about that, there should be a process that they could discuss that before applications came in.
Also, just in the language of this, if this was supposed to be for the LINs, there's an equality by giving each of the LINs the same amount. You're now switching from equality to equity by giving people the right tools that they need versus each LIN having the same access to resources. Well, almost. And so there's a bit of a challenge there between equality and equity, and there's some of the changes that's not necessarily lining up from beginning to end.
Yeah, so that change came because we're not having a lot of LINs apply for this. And so we did have a couple LINs applying for it, and we didn't, and we're at the end of almost the year, right? We have 1 quarter left, and so we didn't want the LINs that have been using it to not be able to use it when it's just sitting there. That's why we opened that up.
Martha, did you have a comment?
Yeah, we've been working on it kind of all the way along. We're just trying to build it so that it's within the LIN. One of my suggestions would be that could the LIN administrator, could you and the LIN administrator make the decision together?
Oh,
so that it was still within the LIN, so that we knew if there's other pipeline of the one to apply, that we could still be involved in the decision, of the application decision, so we knew somebody that wasn't in the LIN, wasn't participating in the LIN at all. And if we were all kind of in the LIN meetings, we're kind of grouping together and saying, okay, this is a project we want, and trying to formulate it. So we don't want somebody to come in and after I've got the LIN.
Absolutely. So we could change this to say, I don't know, something like that, if an organization came to the LIN, it would get facilitated through that.
Actually, I was more going for the approval process, because we're going to do that within the LIN. But I don't know if there's somebody out here that is not in the LIN that's heard about this training. Then they come to you. You're not going to know their LIN. You're going to approve them. And then I'm going to come to you with an application from the LIN that we've been working on for 2 months.
Yeah.
And you're going to say, nope, no money left. And because I didn't know.
Right.
Because I didn't know this person.
Right. And our
so that would be my suggestion, is just a conversation with the administrator.
Yeah. No, I think
approval.
that's good, because our intent is definitely taking money from the LIN.
Right.
For sure.
Yeah. And that would help us know where the money funding if they do get outside.
Yep, I think that's a great.
Okay, let's have the comment over here. Let's go ahead.
So I think that in number 5, I think equitable is better than equally. I don't think create equality across LIN. I think we want to create, equitable, I don't know.
How would you define that, Les?
It's the same as all the pictures. We're not going to give them all one box. We're going to give them what they're needing so that they can all have good equitable access. I don't see it as equality. To me, is an easy formula, perhaps, as opposed to really taking in what they need and what they say they need, and maybe distributing things. I know it's not affirmative action stuff, but you know what I mean. There are times where something would be very beneficial if you spent a little more money here than there.
I understand what you're saying. I'm just asking, how would you operationalize that? How would the staff operationalize that?
Well, I think Martha's recommendation and the way this is written right now, it does reach equity. I think can do is, in addition to how it is right now, because the way it reads right now, inevitably the person that applies for any funds would have some way, because in the top paragraph, like I mentioned, it's support for active local health improvement network participants or organizations. And then towards the bottom of the first page, that where it defines active participant, that's pretty much the definition that the LIN can decide on, who they consider active within their LIN. However, but to make it more clear, maybe on the third page towards the bottom, right above the evaluation criteria, we can add to that bullet point that says the signature of the Director of Finance and Contracts, we can add and LIN leader indicating approval. Or maybe we don't want to require your signature, or maybe just in consultation, the Director of Finance in consultation. So we still require just one signature.
Yeah, so here, I have so in the very beginning, where we added the annual organization part, so what if we wrote it to read, seeks to encourage supportive, active LIN participants and or organizations recommended by the LIN to attend the training. So then they're being recommended by you, it's not them coming to us.
That also you to verify with us that they are an active member of the LIN. That was my whole, that's awesome, my whole point.
I think if we added that will cover what you were saying. If we need to go further, on the other page where it talks about the application process, it says the LIN training request form must be completed and submitted to. We could add completed and submitted by the, that makes things even more level.
Yeah, it would give us a chance to know who's applying, because I don't, right now, the way it happens, or the process is, I don't know if somebody in my LIN would get that as administrator. I wouldn't know who would get that training, so I can't put them on the schedule to talk at the meeting, because I don't know unless they come to me, come back to our LIN and do that, except for themselves.
Okay.
So
Right.
what you're recommending is to add a LIN authorization signature back on the.
No, I'm not saying they have to sign it, I'm saying that they have to be the ones. Yeah, right here.
So I think, Becky, I don't think you want to put it in that purpose, because the purpose is just who's attending. It's talking about who attends it, right? Because you could, and you want the whole community to attend something. I think we're talking about who's applying to sponsor, or to have events sponsored.
Okay, so would we take this and or organizations part out?
Well, that's.
Adding what you're talking about to the application process.
That's what I'm saying.
Yeah. And that it's the LIN who will be the one submitting the application.
Okay, so we'll just add that.
Yeah.
Add that on the application process. Okay.
Becky, I have a question too, actually. It says on the bottom of the third page under proposals are evaluated for, it does say, once funding for that individual or organization has been approved, funding for that geographic area shall be depleted. So if we're not putting limits on how much the LINs are getting, why do we have that particular sentence? Yeah, but if we're not going to put, I mean, it used to be 5,000.
5,000 out, why do you have that?
So we might, the other suggestion is that maybe we need to take this to the LINs. Again, the LINs originally saw this training policy, and maybe we just need to take it to them for a little bit more buy-in and advice.
Yeah, the other potential that I see is in one of the larger counties that takes more money because you're not limiting them anymore. And then I'm at the end, I've organized and to get 3 counties together, and okay, I'm ready. Oh, there's no money left, and it's not because it's going to take me longer to get the buy-in than to get the thing. So that would be the other concern I would have is if all the money's used by April 1st next year,
right?
Then where did our equity go?
Okay.
So I think it just, I'm not worried about the 5,000, but I think there's got to be something in there that helps us know what's going on.
Yeah, absolutely. We can think about it, and we'll come back, and then we'll come back.
Yeah, we'll make the changes to make it still not as restrictive as it still apparently is. And make sure that it's available, and we'll send it out to all the leaders for comment on the final version.
And, you know, another idea, because we have this with some of our other contracts, is just, you know, there's a certain allocation for each LIN, and then by end of third quarter or something, if there's still a bolus of money left, then if there's other groups that want it, then it can kind of be redistributed or opened up for others to use.
Yeah, I will also tell you that shortness of time, we have missed multiple opportunities because the opportunities come in a short time when I do find out about it. And then I have to, by the time I get to the LIN and get it approved, then I've missed the month and a half window to actually hit the actual training and be able to use the money. So the time, a definite benefit, shorten the time.
That's kind of like Rhonda's suggestion, where if you buy the third quarter, that gives you 3 quarters
That's right.
to
I
do
like
it,
that.
and then if there's anything left over.
Yeah,
that allows, I mean, I think that allows you to plan what would be originally allocated to you, but then also even have a potential plan if there were additional dollars available to do a different training as well.
By end of third quarter or just third quarter?
I don't know. We've done it both ways, and you know, as long as we know what to expect.
Yeah, okay.
We could do it
And
either way.
thank you guys for the suggestion.
And I think if you have something planned for order, that you would be able to inform and let people know, yes,
Get the
we have this
application.
training in December, we will utilize those funds. So just maybe a check-in. But question, if the funds aren't used by the end of December, do we lose those funds? What's the ramifications of not using them by December?
Well, they'll be in the new budget.
Okay. So they just roll over?
Well, they don't roll over, we'll just have another budget.
Yeah. They won't roll. Yeah, I agree. I don't think they should roll over an item in the budget for 2020.
Okay, so we'll make these changes and send them to the leaders, and if there's anything that we have here that we make sure to.
Yeah, nobody will do that, Ruben.
Oh, yeah.
Get real quiet.
So positive.
Okay, so we've got several discussion items, and the one I'm gonna add, I'll say for the last, but I'm just gonna put it in your brain to think about. We are getting near the end of the year, and we have about half of the board members that will be rotating off. And so I'm going to ask for a couple people to volunteer to be on a nominating committee for board officers for next year. So think about whether you have some time and energy to help participate in that. But I'll put that at the end of our discussion item. So the first discussion item is the RFP for the auditing firm. Carol and Becky.
So, Becky, I thought that we were supposed to be passing the draft today to give to the auditing firm, and then it would be then they could finalize the audit back.
I kind of had that impression, but listening to the discussion, it sounded like we had to have another conversation or something. I'm happy to take that up. I mean, that was my understanding as well.
Yeah.
I thought maybe something else had come up.
I think what they had asked us to do was actually pass it
Pass the draft.
today,
Yeah.
yeah, and then they would come back with the final.
Right. That's what I understood also, and then when I didn't see it on the agenda and I thought they had changed it.
So do we need to move it under action?
Yeah, that's what we were talking about. We were not talking about the
Okay.
When we were doing this.
All right.
Yeah. So we'd like to slide something back into the action item, and that is.
But we don't have it in front of us.
Yeah.
You don't?
I don't think we can ask the board to approve an audit when we don't have the audit in front of us.
Oh, well, that's fine. All right. You should probably wait then.
Yeah, we'll wait. We'll wait till next.
Never mind.
Order.
You're getting ready.
But we can talk about the RFP for the auditing firm.
Sure. Yeah.
Okay.
So I think we've talked about this before. We shared our problems that we've been having with Moss Adams lately. They switched the staff that we had come to rely on the last year, and the staff that have been put in their place have not been as responsive to us as the other ones were. We're not as happy with Moss's. So I wrote an RFP, and Carol's reviewed it, and I want to put it out and see if we can find somebody. Say about that. That's what we're planning on doing. We're going to go on the street to find another auditing firm.
Discussion. Any questions or comments?
Do we know what the other ACHs are currently using to?
I know who they are. But I want to find someone local, though. I don't want to use here. I'll put the RFP in the newspaper, we advertise it, but I want to specifically target some of the audience. Yeah. Remember that? Nicholas.
Yeah, we did this.
Yeah. I wasn't here when that happened, though, so all fresh and new. My was.
So there.
Oh, no, of course not, but we're, yeah.
That sounds like me.
So we get along.
Do we have the level of threshold for a single audit? Do we have to do that, or?
Oh, I'm sure, yeah.
Okay. Yeah. Okay, that was it. So you want someone that has that experience?
Yeah, yeah. I want someone with not just the audit, but the accounting side too. We had a really great accountant that helped us, and Rachel's not here back there. She left Moss, and the person that replaced her is not only not in Tri-Cities anymore, she's in Yakima, and she's not responsible. For us to have her come over and help us, so it was easy for us to go there. It was easier to have her here. And there's like Ellen Yakima's done a couple things with our books and not told us. And for one of her other audits. So
That's Yakima at all.
I didn't use
Go back. No. Go back. No.
After you said. Thank you. Open the door. We can call by.
It's supposed to be a safe place.
It's so seldom we do this. Yeah.
I know. I'm
Okay.
telling you though, Becky.
Okay. Let us know if you need any assistance. Okay. Let's talk about the October provider recognition. Lauren? Okay.
Yeah.
No.
So in less than 2 weeks, our provider recognition awards will be here. Woohoo, we're excited. If you haven't done so already, please RSVP. This is important for catering purposes. The event is October 30th from 5:30 to 8:30. There will be dinner. There will be a presentation from Don Gilbert on motivational interviewing. There will be awards. So as Carol says, everyone should possibly have their acceptance. There will also be what else will there be there? A red music by Curtis Meadows. Ronnie's gonna dance with him again. And how you register is on Eventbrite, and the link is at the bottom of the invite. Once you go to Eventbrite, there's a description. There is information on hotel accommodations if you're traveling from a far distance.
Like
and we're asking everyone to just semi-formal.
Travel from far and distant lands like Yakima.
Or if you don't like to drive in the day. So we're asking everyone to dress semi-formal because this is an enhanced event. So we hope to see everyone there.
I bet.
So it says semi-formal, not formal. My coworkers were freaking out. That's what I'm planning.
Right.
Okay.
Thank you, Lauren.
Can I ask a question?
Sure.
Can our friend come to this? Because she's been working all year with us.
Yeah. It's RSVP.
RSVP, I'll be there. I told her I was gonna be there dancing.
Any questions?
No, I have a board meeting that night, so I.
Oh, okay.
Aw.
Great. Any, Sheriff,
Send your
want
hand in.
to share about the event?
Oh, I'm not going to tell.
You're not going to tell. Okay.
The red carpet should give you a clue.
Ashley, have you gotten the invite? You haven't.
All set.
Okay.
She'll get it.
Update on Kobe. So, just a couple more things to get through, you guys. I know we're getting antsy here.
And I'm hoping that Dan Ferguson is on the line, because
I just
he's
got
kind of
back
on
on.
the next. Okay, great. So I'll just speak really briefly with Sam and Wes, an update on cohort 3. Do you want to hand me the microphone, please?
Yes. Pass it down.
As you recall, the staff brought forward some recommendations for cohort 3. There were 4 out of 5 organizations that were scored high enough to get into cohort 3. They were Tri-State Memorial, no, not Tri-State, Trios, Garden Village, Chaplaincy, and Ideal Options. The board gave us permission to have a rolling start, so we've been reaching out to other organizations to bring them in. We had a great presentation with Cougar Health, which is a student health center that provides services for the Cougar Washington State University students. I think they're very interested. Wes has been, I'll let Wes talk about IHS, and then we are giving presentations, and we have one scheduled for the 28th, is that right, Lauren, with Prestige and Richland Rehab, since they're owned by the same company. At the same time, we know that there were other organizations that didn't get involved in the cohorts, so we're trying to reach out to them too. I think the interesting thing is that it's just not as easy as we thought it was going to, and I think a lot of it had to do with the fact that we didn't have the chance to do a lot of presentations prior to submitting or sending them to LOI and the CSA, which are daunting documents. So, you know, looking back and thinking lessons learned, we really need to take time to do those presentations, have that personal relationship developed before we ask people to come into practice transformation. It's a commitment. A lot of time for an organization. So we're still working on that, and we'll hopefully have some organizations to bring forward next month.
We can have Tri-State on board also, right?
Tri-State?
We have a, yes, we have a meeting.
We have a meeting
with Tri-State. Thank you.
I think since they are doing the ORS, I think they are one.
Yeah. They're coming.
Let's hope so. So we put together, as Carol said, a very nice presentation where actually we tag team on different slides, members of the staff, and it's gone well in the initial presentation. We're reaching out to Indian Health Services. Initially, we reached out to Michelle Womack, who's the clinical director with the Top IHS clinic, and having a conversation with Jesse Dean, with Tribal Affairs through Healthcare Authority. He mentioned that the organization to go to was the Northwest Portland Indian Health Board, Christine Peters there. So we reached out to her, and she's actually been pretty responsive to get back to us. So Lauren's trying to set up a presentation for her so we can talk to her. We've also reached out to Lori Jackson with Compass Care, palliative care program with Mason. I talked to her. She was interested, but she's been a bit incommunicado over the last few weeks. We hope to follow up with her as well. There's a couple other clinics that we've tried several times, probably as many as 10 times. We wanted to bring them into the system. They're located in Sunnyside, and so far they've been non-responsive. That's Swafford and Homa and Mid-Valley Community Clinic. So we're not going to be so intentional with them. If we happen to be driving through the area and we have the time to stop by and try to do a drive-by with them, we will, but they don't reach back with us and we don't have opportunities to do that, then we're going to forgo those two clinics at this particular point. And if anybody, by the way, I reached out to Sierra on this, and I know she's working on it. If anybody else has contacts with them, those clinics that could tie into us, that would be very helpful.
Yeah, those guys are private practice, so they're going to go or they're not.
March to their own drum.
Yeah.
Sam, did you want to talk about corporate? So your contacts already.
As far as the ones that we've already agreed to contract with, we have reached out to every single one of those. We've been in agreement to try to figure out what day works because they're big organizations. It's been a little scheduled. Practice navigators have been successful with chaplaincy, and I've been attending those as well to make sure that, as all of the other organizations, I'm hoping to get that done. So, it's going well. Huh?
Garden Village.
Yes, Garden Village scheduled. So 2 out of the 4, it's not bad, right?
Ideal option and.
Oh, they did finally.
Ideal option and trio.
Okay, good. So all of them are scheduled.
Yay.
Great.
Okay. Okay, so behavioral health internship and preceptorship support program policy. Dan.
All right. So the Greater Columbia ACH Workforce Committee has been working diligently at creating opportunity for support for our practice transformation organizations and a variety of other partners to, I guess, incentivize and encourage their participation or expanding their clinical training slots. And so we've developed this program to support internships and preceptors.
At the airport.
For all the noise.
I'm sorry, Dan, I can't hear you. There's too much noise up there.
There was such a, we just literally just made a move in a meeting. And so there are a lot of people shuffling about. Apologize for that. So we developed this policy and basically it's a program proposal to work with primarily our practice transformation partners to incentivize their efforts to provide internships and preceptors for behavioral health professions. This is a description of that. And I don't know if you want me to go through this description and then have a question, a Q&A for this, or do we have time for that? What do you think, Carol?
So could I maybe just suggest that maybe Carol walk us through it and you could mute? Because it's hard to hear you, and then you can open it back up if you want to, when you want to speak. Would that be okay without offending you terribly?
No, no offense taken whatsoever.
Thank you, Dan. Carol?
So like Dan was suggesting, we've been working towards developing some kind of a workforce policy for a couple of years now, and he's very involved at the local, the state, the regional, the national level on all things workforce. And we did carve out $490,000 out of the behavioral health incentive funds because we targeted in on behavioral health. From all of the assessments that we've looked at, the CSAs, the surveys, it just keeps coming back that behavioral health seems to be the biggest gap for our provider organizations. So not being able to boil the ocean and really try to focus in then, well, what can you do with approximately $500,000 that would make an impact? And what we realized is that, number one, those organizations that precept or intern or have some relationship with a student are more likely to keep those students in their local communities. So that was an important feature of creating something that could be sustainable and to ensure that some of that investment would stay within the region. So that's where we kind of landed on these preceptorships and internships, because the other thing that we learned through the CSA was that it's difficult for providers to be able to afford that. They don't necessarily have the funds, and it's taking time out of their providers' work lives or their clinical time with patients in order to precept individuals. And so that was kind of a key component that, you know, brought all of this together, is that we are working with providers and supporting the providers. So this money won't channel through educational institution, it will actually channel through the provider organizations, who at one of our meetings, I think it was Rhonda, said that you guys get calls all the time for students needing clinical experience. And that was the other thing that was very important, is that there's a lot of behavioral health professions that require clinical training, and there's just not enough slots across the state to provide that. So this opens up some of that space for the providers and the students to be able to work out some arrangement. And we were not prescriptive in terms of what does that application process look like through a provider organization. There might be some providers that want to intern that have never had the opportunity to have interns working with them. So we kind of left it open with this particular policy, and that the providers will create their own application process. So that's kind of the big overview of the policy. And for today's discussion, it's really just for us to look at some of the major statements, the major ideas that we had, and then we can bring it back next month for actual approval. So the purpose of this policy is to support providers that are willing to precept, intern, or train students in behavioral health who need clinical experience in order to complete their education. And the policy then goes down to say what is the process that they need to follow. We have a bunch of definitions in terms of, you know, who's the applicant, what is behavioral health, who do we consider an intern or an internship. We talk a lot about interprofessional learning, because that's another one of these gaps in terms of team-based care, is that as we're trying to integrate these practices, these students need some assistance in having that kind of interprofessional experience. We talk about who a preceptor is, a preceptorship. And then here is the target workforce state. You might recall in our workforce charter is that we talk about creating the target workforce state. And honestly, I really didn't know what that was until we actually did it. And that's part of this presentation that Chelsea and I put together. But that defines what a target workforce state, which is basically an exercise where you go through and you figure out what the gaps are in your workforce as it pertains to your region and your provider organizations. And then what is team-based care? So with that kind of as the background, we also know that as part of Domain 1 in Healthier Washington, it includes workforce, population health, and value-based payment. So those three areas, Greater Columbia is responsible for moving the needle. And so we give you a little bit of background about why we're doing this, and understanding that a transformation of a practice requires a new workforce. You might have different kinds of professions that are working in team-based care than a practice that exists, that has existing in existence today. Can't talk. So we recognize that some of this might be a new kind of a position that happens as a result of some of these funds. Then we talk about some of the gaps that we have in our workforce, and even just some of the gaps in situations like even access to care, or bidirectional integration, care coordination, just even recognition and treatment of behavioral health conditions. So all of this came out of that targeted workforce state, that we are seeing these conditions in our region, and we're trying to fill these gaps through some of this funding. Then we have requirements for the provider organizations. We state that the preference for the funding will be awarded to provider organizations participating in the GCACH transformation program, although other organizations may apply for the funding. The provider organization must demonstrate the capacity, the competency, and willingness to intern and or precept students. The provider organizations will provide a written plan documenting how and what activities the intern will be exposed to. Are they going to be exposed to practical experience, do projects, patient care, special assignments, research that support federal, state, and community-based programs, policies, best practices, and then preference will be given to providers offering interprofessional learning and or team-based care. So rather than just precept somebody that's just strictly only going to do one function, we'd like to see that provider offer experience. What does it mean to be part of an integrated system? What does it mean to be working with other members in your clinic? And then finally, we'd like to see the intern participating in a learning collaborative so they can bring that experience back to Greater Columbia. Some of the requirements for the applicants I actually took out of a SAMHSA application for behavioral health internship. So that's why that little star is there. I love the internet. So some of those are straight out of the SAMHSA requirements for their applicants. We talked at length about, you know, what kind of degree should you be, you know, pursuing. And originally, and Les can attest to this, kind of like this long list where you have to be involved in counseling or therapy, and then we just realized it's just behavioral health really is, you have to be enrolled in some kind of a degree-seeking program at an accredited higher institution or seeking training and certification in a behavioral health field. And that was to address, there might be people that want to become community health workers, or they might want to be a peer support specialist. And so that's not necessarily a degree program, but it's critical in some of these team-based approaches. And then they must have some kind of a minimum GPA, you know, of a 3-point or a 4-point on a 4.0 scale. The scholarships would not apply to students receiving online coursework without classroom training or instruction. And again, that was coming out of that workforce presentation that we had from CBC, who said that it's just not the same level of education. A strictly online course doesn't give you that kind of clinical experience that you really need. And that, again, the applicant would participate in one learning collaborative throughout their tenure.
Carol, I just realized what is always kind of giving me something, change terminology. You define applicant as the provider organization, and this whole section is really the intern, not the applicant.
Okay.
So if we just change applicant to intern through the whole thing, we'll meet the definitions we have on the front, and it will make sense again.
An intern or preceptor, right?
No, preceptor is the person that precepts the intern.
Yeah, but isn't the funding for preceptors?
The whole funding is for the organization that does the precepting. It's not for the intern.
That's what I was getting confused.
So
Let me give you an example. I've been working with Grace Clinic, and they're doing a partnership with WSU Tri-Cities to get some psych nurses in.
Yeah.
They need the funds to hire the psych nurse to be the preceptor. This would not be that.
The money that they get is to assist them to be able to support them. It's not to be able to give money to somebody else. And if they choose to fund something, they can. But it's all about the organization that's going to do the precepting, not about, we're not taking a student and saying, you're the one that's going to get this money. It's what the organization chooses to use that money in their application. So what we're saying in that part is that those interns, those people who will be interning, have to have certain qualifications.
That's what it is. So just need to say requirements.
Yeah, because on the front we say we define intern as that other person.
Just to clarify the definition, is it defined applicant for the purpose of this document?
Yeah.
You have a question?
Well, Carol, do you want to get through the rest of this, and then we'll open it up to the questions?
Right.
And then we want to see if Dan wants to add anything.
And I welcome comments from the committee members, and Les and Sandra and Raja and Dan obviously have been really involved in this process. So the description is that the internships or the preceptorships would apply for 1 year with the possibility of renewal for another year. And again, this is kind of rough. We say scholarship awards. We changed that to being a support program because scholarship sounded different, so we might have to reword that. But that the awards would be available in the amount of $5,000 up to $40,000 per award, knowing that some organizations might want to precept a community health worker, or they might want to precept a resident. Just a suggestion. That the provider organization would use an existing or develop an application process qualify and accept the students into the internship acceptorship program. The provider organization will demonstrate their need for interns, demonstrate the efficacy of their internship program to Greater Columbia ACH, and apply for funding for up to $40,000 per intern. And that the way that the money would be paid out, if it was a smaller amount, we just pay up to $5,000 to $10,000 up front. If they applied for more, that it would be more like 50% up front and then 50% at the end of the internship. The provider organization will work with the teaching institution which the students will be drawn to establish a process from which students can apply for the scholarship. So what Greater Columbia doesn't want to become is a scholarship program. We want the providers and the institutions to be working together. They probably already have some kinds of relationships, so kind of let them figure it out. The student then would apply for the internship through the provider organization. The provider organization would select the student candidates from applicants seeking or soliciting participation, and that the provider organizations could apply for up to 3 internships and preceptorships. So this is really new. This is something that we haven't heard of any other organization doing. This is something that the state legislature is looking at, but they haven't, quite gotten their policies together. So what we're hoping is that Greater Columbia can be a leader in creating this kind of fund for our provider organizations. And again, it's kind of a big experiment to see, does this work? So we're anticipating that after the discussion today, we can take those comments back from the board, put them into this policy. I got some great comments from Shane McGuire earlier today. We can take it through if we need to. But this is just kind of our first blast of ideas to put something together that would establish a policy around funding for behavioral health and precepting.
So before I open it up for questions, Dan, do you have any additional comments that you would want to put on, that you want to share?
First of all, I just want to applaud the committee for just, kind of really working through this and creating this. And as Carol said, Lori Jenkins, who's now the new Speaker of the House for Washington State Legislature, she actually was running a behavioral health workforce committee, I think, looking at various items for the legislature to focus on. And this was an item in terms of addressing kind of clinical training, how do we develop clinical training slots across the board for workforce, for the behavioral health workforce. So this is an item that the legislature is paying attention to. The other piece that I just want to highlight, so when you think about, even from the beginning of our conversation about what it meant to be an accountable community of health, we talked a lot about collective impact. And this is a perfect definition of what I would call a mutually reinforcing activity that our practice transformation organizations can take part in terms of in the ACH incentivizing them to partner in being part of the solution for developing this workforce. So we can't just rely on the training organizations to figure this out, or the ACH. We need our partner organizations to help with this. And there's just great opportunity here. That's it.
Okay, thank you. Who is that?
Marissa has a question.
Okay, Marissa, go ahead. Do you have a microphone, or can you speak?
If you can hear me.
Yep, go ahead.
Okay, thanks. I want to double check because I'm not quite seeing this in the document that's been put together, and I really do appreciate the thoroughness and the clear thought that's been put into this. And I think that it is pretty innovative for the region to take this approach, but I want to double check that some programs for internships to actually count, or preceptorships to actually count towards a degree, there's an accreditation standard that needs to be met, and I'm just not quite seeing that that element in here. So I think that it would be good to make sure that any potential new internships or preceptorships that do need to meet accreditation standards, that there's support for doing that and making sure that those pieces are in place. Because we don't want kids to spend their time doing something that's not going to actually count for their degree.
Okay, thank you. Eric?
Try to keep it to a few. I actually have a few questions. So,
Here you go, Eric.
So first is, I guess my question is that, is this intended to be supportive or incentive? Incentive, okay. So we're just calling it support to incentivize them to precept. Okay. So that brings me to my next question, and that is there or has there been any kind of assessment to determine why we believe they need incentive to precept?
Yes.
So what's the gap? And the reason why I asked the question, and I just go back to when I was running the paramedic program at CBC, and paramedic students were the first ones that got dropped out of internship locations. And it wasn't that they didn't want to precept paramedics, it's that they did not have the number of hours in the day and the people available to do that work. So, you know, I'm guessing that hasn't gotten much better. What is the gap, and is money really going to fix it?
Can I offer
Please.
any feedback to this?
Yeah.
And I have a couple questions.
Yeah.
Oh, sorry. I have a couple of questions about the application as well. Because it goes back to, and I'm going to get to that in just like 1 second. The application is for the agency to apply, correct? And so when we talk about the description of process, the internships and preceptorships, they'll apply, but really it's the agency that receives the money. So when I'm working with the schools to do internships for programs, so I could have 5 to 8 bachelor's level interns working, as well as 5 social workers and 4 other master's level, plus we have nurses and so forth. One of the biggest barriers is finding, it may not be the placement for them in receiving the internship. One of our biggest barriers has been having the clinician who has the skill level to be able to do the internship supervision piece of it, and particularly around social workers. One of our gaps is when you look at therapy, a lot of the behavioral health agencies are, there's wait times, there's barriers, and for Medicare, when you look at Medicare specifically, an LACSW can bill directly to Medicare where other master's level therapists can't. And so there's a real need for, let's say, LACSWs. But it goes back to having the time to be able to do that. So when I look at this, if I were to, just off the top of my head, I say, I want to have a part-time person get hired, or an individual get hired, and part of their time is really then focusing on, I'm doing internships. My focus will be on doing the supervision, because they have to be done weekly, hour at a time, and that is time consuming, plus the meetings with the schools, plus the, writing the reports, and then the other half of their time is maybe as a therapist. If I look at the process, because I could do the supervision of quite a few students, and then we're looking at scholarship awards are available in the amount of $5,000 to $40,000 per award, or the students will apply, and that's really based off of what the agreement is that I have with the school. Does that make sense? So, right, there's a bit of a disconnect, because really the onus is on me to determine who I'm going to take and who I have the capability of taking, and making that agreement with the school. And that can look different. So I could be a social work that's a 1 year or a 2 year, or I could be a bachelor's level that's the same thing where I'm in for 1 year. So it can really vary on what we're looking at. And so I feel like I'm kind of going all over the place. but I see this as a great opportunity. You know, I think we could make something like that work where you have an option to be able to give somebody the time and the ability to provide the supervision that's needed, because that's one of the reasons why we often have to say no. We just are tapped out. I don't have any more clinicians who can do it. You know, but if you open it up and say, here's an option to look at creatively, how can you make it work? Yes, but this feels a bit like it's targeted more towards the student.
Okay.
And not the agency.
All right.
So part of this is really, though, for those agencies to then connect with their institutions of higher learning to kind of think creatively, innovatively around how to make this work. You know, so this isn't a plug and play kind of thing. This is something that it's going to require some work and some investment.
Okay, Carrie?
Yeah, I have two comments. So I think when you're doing the internships, they're in school, right? So the money goes to the institution, not to the individual.
No, it goes to the
provider organization.
Yes, and when they award their internships, the money goes to the school, not to the individual.
No. It's with the organization.
Goes to the provider organization.
Why do they need funding for that? I thought when you do an internship, isn't that your hours toward your degree?
Okay, there's a huge variety depending on what you're trying to do. I mean, if you're doing your master's in social work, then you have to have so many hours before you can become an LCSW or whatever that acronym is. That's kind of an after you get your master's. So that would be kind of an after thing. Or for some things like nurses, they do a thing before they graduate, and that's during the process. So it's not either or. It could be both. But the school doesn't pay for anything for a student to come to an organization to get their experience. The organization provides that usually free, and organizations see this as a way of enticing people to join the profession or whatever. They're trying to grow people to come in and work for them. So there's some incentive to do that, but it takes, you know, it'll take half again as long or something to do the work because you're taught, you know, it takes longer.
Well, the requirements say they must be enrolled in a degree-seeking program.
They are.
And that's I get that. So what I'm saying is, there was a question about, do they have standards?
Accreditation at the program.
Okay. Well, doesn't the school have to say, okay, Grace Clinic, you meet these requirements?
Yes.
Okay, so that takes care of that issue. The second issue is, a lot of these organizations don't have the funding to hire the preceptor.
Right. And that's what this money could help with.
I asked that question, it was only for interns.
No,
it's for the
preceptors.
The provider organization to get interns. Can it be for the provider organization to get a precept?
Yes.
Sure. Okay, I asked that earlier.
So they're getting the money. How they use the money is up to them. The requirement at the end of the day is that the provider organization takes on the intern. So that's the outcome that we have to have.
So there's no requirement for the preceptor.
Well, that could be maybe accreditation standards.
You have to add that.
So
Yeah.
let me help. Just because it's easier for real time, I think. In our clinic, we have master's level counselors, and we bring students, let's say from Eastern Gonzaga, social work students. When we started doing this, our supervisor, who's the counselor, they had to go through a preceptorship training. That's what it was called. So they had to have so many hours in order to become a preceptor, right? So we had to pay for her to go to training. And then now when we have interns, we block out a certain number of hours a week for her to supervise. So we don't have any funding for that. And so if we did this, we would use that funding to cover the time of the lost appointments plus her time to precept and supervise the intern.
So when you have a preceptor, that time to supervise students is built in.
Built into what?
To the preceptor's responsibility.
But we have no funding for that. So we would use this to be able to pay for that.
Right,
And,
right.
and
So
if we had,
to her point, she was saying, well, we just can't take any more on because they have to do their own hours.
Well, historically, we don't. So what ends up happening is then you have clinicians who are doing the preceptorship who are saying, let's meet during my lunchtime, because that's the only time I have available, because the rest of the time I'm seeing clients. So it's really not built into their schedule to have that as an option, and they're doing it, they're not paid for it.
But this funding could pay for that.
right?
Yeah.
Help
Help support it. Help support it. Help support.
Incentivizes, it
Yeah.
doesn't completely support it.
And it could pay for preceptor or supervisory training as well.
Right, right. So how do you decide, or how does how do you decide whether this is worth $5,000 or $40,000?
I think it's going to depend on the strength of the application from the provider organization.
Or the length of the internship?
Yeah, I mean,
Okay.
these are all good questions, and I don't have any good answers for you.
Plus,
We don't
probably
have
the
last meeting
the
either.
type of person that's being preceptor interned. If you have somebody who has a master's or even a doctorate, they're obviously going to require higher levels of oversight versus somebody who's.
That's a good point.
That's how you budget.
Okay, Ronnie, just a second, let's time check here. Okay.
Okay.
We've got about 10 minutes left of this.
I won't be long.
Okay.
So in my
That wasn't just-
perspective, there's barriers here to the role that I have. So I'm a CHW and I'm also a certified peer counselor. My training comes from from both the Department of Health as well as from the Healthcare Authority. So, but my training's also backed up by UW and my training's also backed up by WSU. Both of those trainings, after completion, I have 80 hours of training, and that was given to me. But what's not given to me is an agency that'll hire me. What's not given to me is the hour of group supervision and an hour of one-on-one supervision. So that's going to cost whatever agency I go into. How I see this, those are the barriers. Those are things that I would need in order to succeed at the role that I have, right? And thankfully, I've been fortunate enough to have work and to be able to get the supervision I've needed and be able to do the work that's required of me under my role as a certified peer counselor. And hopefully, I'm an asset to the organization that I serve and the people that I serve. The part that I like about this, if those barriers were taken away, that I didn't have to meet a 3.0 or 4.0 scale and I'm working towards 3, is that it could open up the door for other CHWs and other CPCs. So they could go to work with a behavioral health organization under the guise that money can help support their supervision. Because the state of Washington Accountable Community, or the Healthcare Authority under the Medicaid, that pays for my employment, because I get Medicaid dollars to pay for the CPC, the CHW. But it has to be in a behavioral health. Hopefully that'll change for the CHW part of my training. But right now, Medicaid will pay for a salary or for those hours that I work. But it doesn't include that piece of supervision. And that would help to be able to get more of me working and hopefully on those ladders. Thanks. So anyway, that's me.
Okay.
That's just.
So, do you have comments to work with? At this point, are you asking for a motion, or are you just giving feedback?
It's like the first week.
Okay, that's what I thought. Okay, so we're almost out of time. Are there anybody have any burning comments that they haven't had a chance to share that they want to at this point?
I will just say on this topic, great job. I think it's extremely important. I wish there was a way we could do it where you could just create more time.
Great
The bigger
answer.
issue on the receptor issue is time.
Agreed. Good point. So, and Carol, if people have additional comments, should they send them to you directly? Or should they send them to Dan? Where should comments go?
Yeah, just to me or Dan.
Okay.
However, and I do have one more, just try to move this.
Well, just hold on a minute, because I have my moves. So I know that people have been dying to raise their hands. So I'm looking for a couple of willing members that would like to participate in the nominating committee to help with our 2020 Board of Directors. Madeline and Ronnie, thank you both.
We're supposed to also get someone from leadership too, if I remember right. The nominating committee has some leadership too.
Well, they're right here.
Leadership as far as?
Council.
No, the nominating committee comes up with from board members.
I just wanted to make sure.
So thank you both. And who is the point person on the staff? Is it you?
Yes.
Okay, so Carol will be in touch. Thank you very much. Okay, Carol.
Okay. First of all, you all noticed that Lauren has a new last name, so congratulations. And that, unfortunately, I didn't make enough for everyone, but yesterday we received word from Myers and Stoppers that we received 100% for our Star 3. That's about $5.7 million. So, a letter of congratulations and the way that it works out. So you'll see 3 categories: the DISHP, the IGT, and shared domain. Shared domain money, even though it looks like it would be great to have, we don't get that. That is a pass-through that we, because we're using intergovernmental governmental funds, those kind of go back to the IGT organization. So we get DISHP and our portion of IGT, which is about $5.7 million. So even though it says total incentives are 8, the 4.0 million of that goes back to shared domain. IGT.
Okay. Okay. Yeah, does anybody else have anything burning? We are at 2 minutes. Anybody on the phone have anything burning that they would like to bring up before we adjourn this meeting? Okay, with no further business, I think we are adjourned. Thank you, everybody.
Thank you. Good job, Carol. And Ron.
So far away. Well, I was right over that door. Never gonna let that one down.